I get to create my own field. And kind of like you, I'm very like entrepreneurial in my mind and trying to see like, how can I best create value and not just be so pigeonholed and stuck, but be adaptable.
All right, guys, welcome back to the Adam Nessum Show. Today we have Darsh, who goes by Doctor Darsh on social media, known to many pre-meds and health professionals out there. He is a first-year physical medicine and rehabilitation resident at Penn State Hershey with the goal of practicing musculoskeletal regenerative medicine in conjunction with integrative and functional medicine. Darsh focuses his social media on teaching others how to optimize their mindset and lifestyle. So thanks so much for coming on. Excited to talk to you.
Hey, Adam, man. Thanks for having me on here, man. Absolutely likewise. Excited to see what we're going to be talking about here. Yeah.
Awesome. So, yeah, I mean, I've been following you for a little while now, and I think you're one of the, I wouldn't say few, but one of the accounts that I would say I trust when giving out advice to pre-meds and just on making students, you know, whoever's out there following you, just better people, productivity wise, lifestyle wise, and actually give them very actionable advice. So how did you get into that social media world while also, you know, being a med student or resident? I'm not sure at what time you actually joined. Can you take me back to that?
Yeah. So I actually started getting into it, I would say my third year of med school, in between my second and third year of med school. And what's funny is I've always wanted to kind of have this presence to give back, like become a mentor, a coach, kind of what you're doing, right, with the pre-med consultants. Because growing up, I don't think I ever really had that like true mentor that I can look up to and just get advice from. But I've always fell in love with like inspirational quotes, like E.T. the hip hop preacher on YouTube, and like look at these motivational videos and be like, wow, I'm pumped. Like, let me learn these life hacks so that I can become the best version of myself. So I said, how can I do that? And I was shit scared, honestly, of doing it like through Instagram, going on lives, putting my face out there. I grew up with a stutter. I had like a public speaking fear. And I started to realize like, no, I have to lean into my fear, right? Like I have to kind of just go into that. I started doing it a little bit by little bit. Maybe I was getting judged, but honestly, I probably wasn't, right? Like I think we're also afraid of all eyes are on us, but in all honesty, everyone's eyes are on themselves, right? Everyone's focused on their own issues. So, you know, I decided, hey, I'm just going to keep continuing with this. Let me see if I can create value. And so far, I think I have. So that's kind of like you said, I mean, I'm focusing on trying to optimize people's mindsets and lifestyles, especially pre-meds, because as you know, man, the journey can be tough. It can be rough. And there's a lot of myths out there. And I try to focus on being one of the realest doctors on Instagram, giving like the truest perspective of what medicine is and what I went through.
100%. And that's definitely needed in today's social media climate. There's a lot of fake stuff out there, just like a bad perception of things. And you need to see the good and the bad. So I think you do a good job of that. Have you felt like, because I think I can relate to this a little bit, that you've grown yourself and learned new things by putting yourself out there and having to teach others? It almost makes you reflect on yourself, on what you're doing.
Oh yeah, dude. I think that's the other reason I did it is I needed to hold myself accountable, right? Like if I'm going to preach these things, it's only going to make me better. So if I'm talking about like, hey, people need to start reading more, people need to meditate more or get into the gym, fitness, diet, lifestyle. If I'm going to be preaching those things, then I got to do it, right? And when you look at a physician, right? As a physician, if you're going to be telling people advice in terms of diet, medications, but you yourself look in the mirror and can't be doing those things, then you know you can't really be doctoring as well as you can. So it kind of goes hand in hand.
100%. Absolutely. And I think that a lot of those things that you just mentioned overlap into the specialty a little bit that you're pursuing. Could you tell people, the listeners, a little bit about PM&R? Because I don't think it's one of the well-known specialties out there, and actually something I'm interested in.
Yeah, absolutely. So PM&R, right? So physical medicine and rehab, also known as physiatrists, not physical therapists, not psychiatrists, but physiatrists, right? And like we like to say, it's medicine's best kept secret because honestly, there's not much exposure to it. Even going to a DO school at VCOM, Virginia, I had one professor, I think, that was physical medicine rehab, and I honestly didn't even realize it until I wanted to do PM&R. So there's not much exposure to the field, but you learn everything about it. So what is it exactly, right? So physical medicine rehab. So the rehab portion is exactly what anyone would think of, right? When you look on TV and you might see those advertisements of like a wounded soldier with like an amputation, a prosthetic, trying to walk on like the 2 bars across like the room. We're the doctors that would manage that whole process. So, a lot of the inpatient side would be like spinal cord injuries, traumatic brain injuries, stroke rehab, general rehab. And we would medically manage these patients as they go through maybe a month or two of rehab to get back to where they potentially could be in their life. So our goal is to optimize their lifestyle. And then on the outpatient side is where you can kind of see the physical medicine, which really deals with the musculoskeletal system, nervous system. So like movement disorders, sports medicine, interventional spine, where you do injections for back pain medicine, where you can do nerve blocks around the whole body, cancer rehab, pediatric rehabilitation. The list goes on. So for me, I'm interested in using like ultrasound and doing orthobiologics, using like your own body to kind of heal itself.
Wow, that's awesome. And it really is a broad field. That's the one thing, as I look into it more, you can go into so many different areas, even within this specific specialty. Right. So can you explain a little bit more about what that subspecialty you just mentioned for yourself would be doing?
Right. So musculoskeletal regenerative medicine, right? So I'm dealing with the musculoskeletal system. So I'm very interested in exercise physiology. I'm very interested in the physics of the body, fitness, those kinds of things. But a lot of times, like we see things like osteoarthritis, shoulder pain, shoulder tears, tendonitis, tendinosis. And how can we improve athletes or improve people to become, again, functional with their own body? So a lot of times we think of steroids, right? But now we're starting to see like, hey, the more and more we give steroids, sure, it reduces the pain, but also reduces the inflammation. And now we have this new way of thinking of that inflammation is actually helpful. That inflammation is actually regenerating all the tissue that you need. So you look at things like PRP, platelet-rich plasma, where you take someone's own blood, you spin it down, you take those platelets, which have a lot of growth factors, and you inject it into that site, let's say the knee. And for 3 months, it's a lot of pain because there's so much inflammation. But after that, you start to see this regeneration of your tissues, your cartilage, and things like that. So there's a lot more evidence base that needs to come out with like stem cells.
Right, I was just about to say, this is like the area that I know is hot right now in terms of research, because there's not a lot of evidence-based stuff out there, but it seems like it is trending in that direction.
Right. And like, that's the beauty of P&Rs. Like, it's always going to be on the forefront with like artificial intelligence, like prosthetics. Like, there's crazy companies out there coming out with like artificial hands that you can like put and wire with your brain and all these crazy things. But yeah,
Neuralink.
Neuralink. Yeah, exactly. Elon Musk, all these things, man. So for me, musculoskeletal regenerative, I think, is something that I really love because it allows you to use your own body to heal itself. And then also using integrative and functional medicine. So what functional medicine is root cause analysis. So I think in Western medicine, we often just treat the symptoms and then the patient comes back again, right? Like for internal medicine right now, I'm treating patients, sure, they get better, but then they come back in like a month. And that's where the burnout comes in for me. So I want to be a practitioner who can at least figure out why those symptoms are happening in the first place. What is that disease process that I can heal? And then, those symptoms don't manifest. So it's more of a preventative approach.
I was just going to say more taking like preventative care, which is something that definitely needs to be more emphasized within healthcare now.
Absolutely. Yeah. So
you mentioned that you said PM&Rs, and I would agree with you, is one of the best kept secrets. So how did you find it?
So I actually shadowed PM&R in high school. I was lucky enough that I had a cousin at UPMC, so I kind of did like a bunch of shadowing and surgery, PM&R, all these things. I actually hated my PM&R shadowing. I was like with the speech therapist. I didn't know what was going on. Right. It just wasn't as exciting to me. And then what's funny is when I was a third year, I did my OB-GYN rotation, and oftentimes residents will go around the room and ask the students, "Hey, what do you think of going into?"
Like every rotation I was on, I got that question.
Right, yeah, right? Oh, what do you want to do? And I was like, I'm thinking like GI, internal medicine, because like microbiome, alternative medicine, like functional medicine. And one of the residents was like, well, how come you haven't thought of PM&R? Like if you're trying to do alternative medicine, that's like the best avenue. And I'm like, why haven't I thought of that? Like I've been an athlete growing up. I'm really into musculoskeletal exercise physiology. So I decided to look more into it. Did a rotation in it during my third year. Absolutely fell in love because I saw some of the inpatient and outpatient side. And I was like, I gotta run with this. And the fact that like I get to create my own field, and kind of like you, I'm very like entrepreneurial in my mind and trying to see like, how can I best create value and not just be so pigeonholed and stuck, but be adaptable. And PM&R is the perfect field for kind of like taking bits and pieces of everything you want and then just combining it and doing your own thing.
I like that. I like that answer a lot. I'm sure that came off well during your residency interviews.
Oh yeah.
So you actually said, I think this is an interesting point, that you hated the first experience you ever had shadowing in that field, but then came full circle and ended up falling in love with it. I think that's a great point especially for any pre-med listeners, that you may have one bad experience in a particular field. Maybe that's even in medicine as a whole. That doesn't mean you're not meant for that field. And that's why I say when you do shadow, you should get multiple different experiences, meet with different physicians, different specialties, because you're going to get such a narrow view just from if you shadow an inpatient hospitalist versus an outpatient dermatologist versus someone in PM&R versus a surgeon, that you really need to see it all to see, okay, I could see myself in this specialty. I can't see myself in that one. And I think that that's really important to know. And just whatever you're doing, don't take like one experience as the end all be all.
Yeah, I couldn't agree more. And it's funny because even OB-GYN, learning about it, completely hated learning about OB-GYN in school. Did horrible on like that block. And then I loved OB-GYN in clinic.
So I was just about to say, I had a very similar experience.
Even like clinic and learning, like two different things. Like, yeah, biggest advice to pre-meds is like, sure, figure out what you don't like, but don't just hold on to that. Don't go into medical school saying like, oh, I'm 100% like want to be a neurosurgeon, or, 100% want to be cardiothoracic surgery. And whenever you shadow, ask those physicians, hey, if you could go back, what would you have done differently? What are the things you like? What are the things you don't like? Like, definitely get that full spectrum of answers, because you'll definitely get more clarity out of it that way.
Awesome. Great insight and advice. So switching back now to the entrepreneurial side that you were talking about, what have you been doing in that space, or do you have any specific like ideas or goals? I know you've been doing a lot more mentorship stuff now, and I haven't been following very closely. So just curious like what you've been up to there.
Yeah. So it's just like a lot of pre-med coaching here and there. Just trying to build like the following, the social media. I did have a podcast called like Optimize Your Life, but now coming up soon, probably have a different podcast. I'm actually teaming up with another PM&R resident, soon to be fellow, about regenerative, like functional medicine, and just trying to bring up doctors.
I like that.
Yeah, to like trying to just convince other physicians, like, hey, we can't be so closed in on this box of just Western medicine, and what are other practitioners doing that are really helping out their patients, so that we can kind of expand our minds and start using these different techniques to really promote healing rather than like just sick care system. So.
Right. So what do you say, especially when that topic comes up, to people that obviously are tentative because maybe there's less evidence-based practice there, or is there more evidence-based research there that we just don't even look at?
Yeah, so it's both. It goes both ways. So a lot of times there actually is the evidence, but we don't even like think to like turn an eye to it and look at it. The other thing I say is when we do evidence-based research, right, all the research is on a bell curve. So what we're doing is actually not personalizing care for the patient, right? And the way medicine should be going is more personalized care, more, looking at people's genetics, things like that. But when you only look at the research, you tend to narrow it down to just that bell curve of the averages. And so oftentimes patients might be outside of that bell curve. So it's very important. I know it's super tough in the hospital because hospital is basically treatment for the masses. It's not
what's the standard of care here. We're going to stick to that, which obviously makes sense for most occasions.
Exactly. Because there's no possible way you can run a hospital just super personalized, but it's at least trying to get people to think like, hey, what is one thing I can do different with this patient in front of me? Even the smallest way that might benefit them. Even if it might not be in the research, it might be what they need, right? It's kind of like how there's not one diet that works for everyone. It's whatever works with their epigenetics and all these different factors. It's about experimentation, kind of figuring out what works. So.
Are there any things that you see coming out besides like PRP that you're excited about to eventually bring into practice?
Oh, man, that's tough. I think, at least in the functional medicine space, the gut microbiome, the research coming out with that, all these companies looking at like what foods are actually helping these people. Companies like Biome, where you'll do a gut panel and kind of see like, hey, these foods are not helping me, but these foods are. Everything's just so expensive right now, but once more and more companies kind of, I think, it'll come out to the masses. So I'm just excited for personalization of medicine to people.
Gotcha. It sounds like with all your passions within this space and entrepreneurial spirit, I mean, I could be wrong here, but is the ultimate goal to eventually own your own practice where you can do this type of work? Because I feel like it might be, as much as I love teaching and academics and stuff, it might be hard to do that type of stuff in an academic setting. What's your take on that?
Absolutely. That's kind of what I get torn up on, because a lot of people are like, man, I can see you as like a program director and like, I would love to be in academia and teach. But the problem is you're kind of held by the ropes, from up above. And yeah, like doing functional medicine stuff, you kind of need your own practice. So I have thought about that, but then the only thing is, would I be restricted in one area, and how much like would I want to travel, or what if I'm not satisfied with living in that area if I start a practice, right? So I don't know if it's being a practice or being part of a functional medicine institute or like a wellness center.
Interesting.
That's something I definitely got to like look into more and talk to other people and see like, hey, what are the kind of pros and cons of like private practice versus institute versus academia.
Got it. Yeah, I'm sure you have some time. Four more years, basically.
Yeah, exactly. Fellowship. Yeah.
Oh, right. What you're going to do one fellowship, right? So you're on your. Can you explain how it works for everyone? You're on your intern year now, basically.
Yeah. So PM&R is one of those different fields, as well as like dermatology, radiology, neurology, ophthalmology, where you do 1 year of a prelim year, right? So that could either be like internal medicine, surgery, or something called a transitional year where you get like more elective time. And then after that year's done, you then transition into your respective field. So for me, PM&R. So it's a 4-year residency. That first year is an intern year, which I'm doing right now. And then I do 3 years of PM&R after that. And then if I want to do a fellowship, I do a fellowship after that. And in PM&R, most of the fellowships are 1 year. The only one that's 2 is pediatric rehab. And then the other thing about a lot of the fellowships in PM&R is that some of them are unaccredited, right? So if I want to do like a regenerative medicine, it would be unaccredited because there's no real governing body for regenerative medicine. It's kind of just somewhere you go to a clinic and you get taught by a mentor there and like pretty much just do it, for a year or so.
Right. And then there's also like sports and pain, and I know there's some combined sports and pain.
Yes. Yeah. There's a whole variety. I'm still trying to like navigate through that, but yeah, absolutely. So a lot of people look at like the outpatient side as a spectrum from like sports to pain. And then in between you have like interventional spine, which is like sports and spine. So there's like a whole spectrum of things that you can do.
So much.
Yeah.
Wow. So what's your advice to any pre-meds out there that are just getting started on this path, have no clue what they want to do, still trying to figure it out?
Ooh, I would say take gap years. I think just like having the ability to give yourself enough time to make sure like, hey, this is what you want to do, right? Like I think the latest study came out saying that 51% of physicians like burnt out, and most physicians would go back and not even do this again. And I look back at the reason as to like, why is that? Like, sure, there's issues within the hospital system with burnout, but I often think like a lot of these physicians went into med school at such a young age. And thinking like you want to be a doctor at 16, 17 is very different than knowing when you are a doctor at 30, right? Like there's just so much growth and your whole life perspective and outlook changes at those 2 points. So I would say like take your time and make sure this is what you want to do. And the more time you have, I think you'll have an easier time in med school. You'll have an easier time through like the rough patches. But you'll also learn to kind of just stay on your own path and realize like everyone has their own circumstances. I think in pre-med culture is so competitive. We often just compare ourselves like, oh, this person got like a 4.0, this person got like a 5.12 MCAT. Like, what am I doing? And you just got to realize like, hey, you guys aren't probably even going to end up in the same specialty. And if you are, you're not going to the same residency. And if you are, you're not going to do the same fellowship. And if you are, you're not living the same life. You're not marrying to the same, like you guys are living your own lives. Appreciate your journey for what it is and for however long it might take or however short it may be.
That's a great point. And I say to almost all of my students at this point, take a gap year. At least 1, if not 2, especially now with the new MCAT. It's harder to get all your classes in. It's harder to just be ready to be the best applicant that you could be without taking at least a year off so that you can make sure you're getting your MCAT in and getting those experiences. I always say I've yet to hear a student that has told me they regretted their gap year. It still hasn't happened. And I've mentored hundreds, if not thousands of students at this point. Yeah. So, and I may be a little bit hypocritical in saying that because I didn't take a gap year, but I was like one of the few people, I wouldn't say few, but I like went in knowing this is what I wanted to do, had the grades and the MCAT score and the shadowing experience and had that all set up. And even now, I mean, I'm taking a gap year in medical school because I never took that year before it. So I think you definitely cannot go wrong with taking that gap year. I'm curious, I'm assuming you took one, and what did you do during that time?
So what's interesting for me is I was actually in a 7-year BSMD program at Temple, and I missed I missed a GPA cutoff by 0.02. Biggest blessing that's ever happened to me, because without that, I wouldn't have had these gap years. I wouldn't be who I am. I wouldn't be on this like personal development journey, growth mindset. And so I applied 3 times because I was like, oh, I'm just going to go straight in. Didn't get in. Finally got into like VCOM, got waitlisted and got in. But during those gap years, so I did 3 things. I was a pediatric emergency scribe at CHOP. So I did that for about 9 months. And I was like, all right, I'm like, it's saturated. Like I learned everything that I could. There's no point being here. Moved on to getting paid employment at a pharmaceutical outsourcing company. So I was like a lab tech for them, kind of just like cell culture, all these different things. Did that for about 10 months. I was like, all right, saturated. I learned everything I needed to. Then I was like, what else can I work on with my application? I thought like research was something important. And I was also at that point where I was like, man, do I have to take the MCAT again? And do I want to, or is medicine right for me? So I was thinking, hey, backup for me was actually going to be like a master's in like exercise physiology or something. So decided to actually just like cold email like 50 researchers from like Maryland to Boston, trying to get free internships, just being like, hey, can I do any research? Finally got an email back from a doctor from UPenn doing cancer rehab research. So I did that for about 10 months, got to write my own abstract, presented at a conference. Super, super awesome experience. And what's funny is that PI is now at Hershey.
Oh, wow. There you go.
And full circle kind of again. So, and she's in PM&R department. So,
oh, wow.
Yeah. So pretty fun. Those are kind of 3 things I did. And travel.
That's good. Yeah. I had plans to travel this year. It definitely fell through. So I'll have to find some other time, hopefully. Two takeaways I would like to give to the listeners from what you just said. What I'm hearing is just immense perseverance. First, with the applying 3 times to medical school. So for the students that are out there that they didn't get in on their first try, that doesn't mean you're not going to be a doctor. You should be reevaluating what's going on. What improvements can you make? And like Darsh said, I mean, look at the initiative he took to cold email like 50 different people to get a research position that eventually helped him on that path. I mean, most people wouldn't do that. Where did you get that type of mindset that I'm gonna be persistent, I'm not gonna give up, and I'm gonna take that extra mile that most students wouldn't do?
Yeah, so it was funny because I think I had a lot of hubris being in a 7-year program, right? I crushed high school, got into a 7-year program and all, and then you just saw this ego kind of fall with the not getting through, and then you start to really just let it sit in and say, man, I need to make changes now, because I started to realize, man, I'm not competitive like I thought I was, but to be in this league of other physicians and stuff and constant growth and doing what I want to do with my dreams and goals, I got to change, right? And then I started getting on this personal development and becoming better, productivity, efficiency, reading more, just like all these things. And, I was like, I just can't give up. Like if I do, what am I telling myself, right? Like I can't just go from, doing very well to nothing and then just staying there on the ground. So I had to pick myself back up. And even then I did that research for free. Like I was willing to say, hey, I'll do 10 months just to do whatever, just to get my name out there. And I started to realize how important networks and connections are. And I actually learned that from my brother, who's a dentist, and he got a lot of his opportunities just through networking. And still to this day, I'll say networking more than anything can help you get anywhere. So it's always important to just like have good social skills, communicate, and just, put your butt on the line and just do it.
Yeah, 100%. And then going back again, kind of to the social media, I'd say that's been really helpful, at least for me, with networking. Can you talk a little bit about, what that experience has been like for you in terms of the benefits it's given, but also, as we've probably seen and many have seen, like there are definitely the drawbacks to social media, and putting yourself out there isn't without its risks as well.
Yeah. Absolutely. So the first thing I'll start with is like, as an athlete, I always loved competition, and I always thought competition was the key to getting ahead, right? Until you get on social media and you realize, man, I'm not growing. And then you realize collaboration is the key. Meeting people, growing from them, doing things together, keeping up the positivity with other people and helping them grow as well will only help yourself grow. So that's the first thing I learned, is like collaboration is key. Other things with social media is just like you said, just like collaborating and having a network of people that can really support you. Like even going on Twitter for PM&R, so many like PM&R physicians on there, just like giving advice, all these different things. So it's been really cool to just connect and get opportunities and just constantly keep my mindset growing because of that. So I'm hearing so many different opinions. And then the downside is oftentimes in medicine, we just see the glamorous side of things with social media, right? Wearing the fake scrubs, which is another kind.
It's a whole nother topic.
But like wearing these white coats, smiles, cool pictures when studying. But then it's like, where is that side where it's like, this sucks? Like, it really isn't fun. And that's what I try to bring out too, is like, sure, I don't hate my life, but there are times like when I was on night shift, I made a post and like, I legitimately had a moment where I was like, I'm quitting medicine. Like I'm done with it. Can't do it. And then, you sit on it again, you think, okay, from now on, I just got to think positive and improve on that. What can I improve on? So no matter what like downsides there are to medicine, I always try to bring up something about how can you improve on that? What value can you take away from that situation? So that's kind of like what I try to focus on with the social media in terms of ups and downs. And then recently, of course, fake news and misinformation, right? Like this whole DO versus MD stigma, and all this. So that's like the downside of social media. So
can you give a breakdown for our listeners of like what happened? And also I think it'd be helpful because you're a DO, that perspective.
Yeah, absolutely. So given the like current political climate, President Trump's doctor is an osteopathic physician, right? It's an osteopathic physician. Hopefully, I'm sure all your listeners kind of know what that is, but it's a 4-year medical degree similar to an allopathic school, but we also do 250 plus hours of OMM, right? And that's like really the only difference. And people ask, well, why is there a difference? Why don't they just combine? It's because it's rooted in the philosophy. So a lot of the old timer like DOs still don't want to like have an association with MDs as well. And that's what's something that people don't know about is they think it's all like good and glorious side. But these doctors that are, who are really diehard DOs actually didn't even want the merger to happen in the first place.
It's interesting.
Because they believe our philosophy is different with holistic and mind, body, spirit. The sad thing is you don't learn that when you go to an osteopathic school. There's not one lecture I had where I'm like, oh yeah, mind, body, spirit. This is what.
Right. It's OMM. OMM is the difference mainly at this point.
Right. That's it. Just the OMM, just the board exams. That's it. There's no difference in the philosophy. So when, I get a lot of questions of, oh, like, why'd you choose DO? Why'd you choose MD? Honest answer is I got into a DO school. So I went.
100%. Yeah. I advise most of my students, especially ones that come to me with lower GPA and MCAT scores, but really in general, I'm like, you can be an amazing doctor no matter what, whether you're an MD or a DO student. So you're really limiting your chances by not applying to both schools. With that said, and you can correct me if I'm wrong, if you just look at the data for certain competitive specialties, it is harder to get in coming out of a DO. Like if you want to go into neurosurgery, orthopedic surgery, and dermatology, like it's still going to be harder out of a DO school. So you need to know that going in, but at the same time, it'll be interesting to see what happens with the merger. And I would assume spots will increase in the amount of DOs that are filling those competitive specialties, as long as obviously the board scores are there, et cetera. But I guess we'll have to see what happens. But jumping back, so there's been this big public misconception that DOs and MDs are these different types of doctors, which is really not the case.
Right. So yeah, the other thing is like osteopathy, right? Is like what they're using in all these terms. And yeah, in Europe, there's a thing called osteopathy, which is very different than osteopathic medicine.
Yep.
And osteopathy is not considered a physician in the UK or Europe or wherever they're talking about. So they're taking that concept, across seas and bringing it here. And that's where this misinformation is kind of, coming up. But then what they're doing is they're just making it a political battle because it's Trump. But people don't realize Biden's doctor is also an osteopathic physician. And like
and that shouldn't even be that shouldn't be like what people are being judged on, the MD versus DO, especially given the training's essentially the same.
Exactly. And you absolutely nailed it. And I tell all my pre-med students the same thing, that if you're looking to go into like plastic surgery, dermatology, these like very competitive things, you're better off going the MD route because you're going to have an easier time. Going the DO route, it's possible, but a lot harder. And then talking about the merger. So last year was the first time there was the merger. We actually saw an increase about 113% match into orthopedic surgery from a DO.
I saw those stats, which was pretty cool. So
yeah. So I guess it's a good thing, but we'll see now with USMLE step pass fail how that kind of shakes things
out. Now it's just I think. I don't know for sure, but I think now it just puts all the pressure on step 2 and doesn't really change much. Although I think step 2, which I'm studying for now, is in general a better, more clinical exam. It's more like actually what you'd be thinking of as a physician rather than the very specific enzymes and different biochemical pathways that, which is important to know and have an understanding of. But like, do you have to memorize every single one? Will that affect how good of a dermatologist you're going to be? I don't really think so. But so I don't hate the pass fail, but I know anytime you make a change, there's going to be some issues with that change no matter what. There'll be drawbacks to it and hopefully benefits as well.
Absolutely. Yeah. Couldn't agree more.
Awesome. Well, thanks for clearing that up for any of the listeners. So if they don't, because we do have listeners that aren't in the healthcare space. And so I'm sure a lot of people are not understanding really the difference between osteopathic and allopathic medicine, MD versus DO. So that was helpful. Awesome. One last thing, what would you leave our listeners with? One piece of advice that you would give them, and then where can our listeners find you?
Yeah, sure. So I think, the biggest thing I can tell people is focus on just becoming a better version of yourself by 1% every day, right? I think in the pre-med community, it's so tough to do that because we look at people who are so aspirational, right? Like I see people that are like, oh man, cardiac thoracic surgery, neurosurgery, or internal medicine. How am I ever going to reach that? You don't have to do everything in one day, right? You don't have to do everything in 1 year. Just focus a little bit at a time, 1% every day. If you compound 1% for a whole year, that's 37 times better. And that's a huge difference, right? If you look at a stock price and 1 year going up 37 times, everyone would be like, wow.
I'll take it. I'll invest.
Yeah, absolutely. So focus on just becoming better, just a little bit at a time, stay in your own lane, don't compare, and just enjoy the journey. It's a long journey. Enjoy it. Don't be afraid to ask for help a long way and just have fun with it. Yeah. And then where people can find me. So I'm most active on Instagram at Dr.Darsh and doctor spelled out. And you can go ahead and message me there. I respond to all my followers. So.
Awesome. Love it. Well, thank you so much for coming on. Really appreciate it. I think this was a lot of great nuggets for listeners, and hopefully anyone out there listening will take something that was said and actually apply it.
Yeah, sure thing, man. Thanks for having me on here, dude. This was fun. So loved it.
Completely great. Talk soon.
Yeah, absolutely, man. Bye.